Hello, I'm Dr. Brian Dorner from Capital City Cosmetic Surgery. We're here today with Pat. Pat's one of my typical patients. She ranges somewhere between 35 and 55 years old. We're not going to tell her age today. For Pat today, the areas we're going to be looking at are particularly around the lips. As you can see, she has some fine lines and wrinkles. They call those barcode. She doesn't like those. That's probably on her face what makes her look the oldest. So the CO2 laser is going to do a really nice job of eradicating those wrinkles. If we move back, let me have you turn a little bit to the right, move back to the cheeks, you can see a little bit of age spots through the side of the cheek. She has some fine lines out here. She does have some fine acne scars also on the cheek, so we're going to use the CO2 laser particularly for the wrinkles out here. It's also going to help the acne scarring. But if you look at these little fine brown spots, the erbium laser that we use afterwards is going to clear up a lot of that pigmentation issue. So this device is particularly nice because I can address multiple different issues in one treatment. If you move up to her eyes, she has a little bit of bagging under the eyes, some fine lines and wrinkles, and a little bit of crow's feet. You see how that sort of exaggerates that? So we're going to fix that with a CO2 laser. We're going to do this procedure. It's going to take about 45 minutes. We do it under topical anesthesia. She still has a little bit on her neck here. Most people, they're going to be red and swollen for about 3 or 4 days. Once that has cleared up, they're really good to be outside. The new CO2 laser is what they call fractionated. The advantage of that is that it really reduces your downtime, and most people are using that technology today. We're back with Pat. We are 3 months out from her CO2 laser. She's done very well with it. She's been very happy with the procedure. Before, she was feeling older. The lines and wrinkles were really troubling her. So the laser has helped eradicate those. If you look on the side of her cheeks, some of those acne scars and some of the fine lines have improved. Around her lips in particular, that's where we see some improvement with the barcode and the fine lines. And also under the eyes are tightened up. So she's done very well with it. She had minimal downtime. She really appreciate the procedure, and actually I think you might be thinking about doing it again, aren't you? Mm-hmm. So overall it's been a success.